Today, I'd like to continue a look at the disparities in healthcare based on a study by the Commonwealth Fund, a nonprofit group that took a look at health uh, disparities and health outcomes and health access in New York State, and see what this reveals about the overall question of systemic racism, which is a question that people have been raising in terms of, is it a reality? Is it something made up? Is racism something that's really just kind of behind us? So it's a question I think worth exploring. Healthcare outcome, they have improved over the decades. And this is certainly a sign of the progress that we've made in the healthcare area, which has been certainly a good thing. And the Commonwealth Fund study points that out. But it's interesting with all that progress that the gap between racial and ethnic groups remains basically the same. So there's been progress on the one hand, but the gap is still there on the other. What would be some of the reasons that this would exist, this gap? And of course, if there is this gap and it's got a racial component to it, would say to us that maybe there's some inequities that we could address. So why is there this gap? Some possible explanations are offered. First of all, decades of inadequate funding. So when there is a gap, you look at it and say, well, why is there this gap? Maybe let's look at the funding. And if the funding isn't adequate in terms of the services that are needed, we'd say, well, maybe we should do something with regard to the funding. But then again, when you get into funding, you get issues of taxation, you have other areas of need that are competing. How do you balance all that out? Difficult, complicated questions, obviously. Second reason that's given is inadequate efforts that have been made to meet the healthcare needs of people of color. So if there are these healthcare needs that people have demonstrated and that have come to our attention, what are we going to do to meet those needs? Are we going to make a genuine effort? Is it going to be a partial effort? Is it going to be no effort at all? And what does this say about us as a society and about our healthcare system overall? So these are some real challenges that we take a look at when we look at this study. One of the factors that they go into in the study is the rate of deaths that could have prevented with more timely and effective care. So certainly this would be a major concern. So they look at the different deaths and say, well, this was the cause of the death. If the care would have been more timely, more adequate, this death really could have been prevented. So looking at those figures, it really is something that is significant because certainly we want to do everything we can as a society with our healthcare system to prevent deaths. So what are the rates? The rates, according to the study, were 139 per 100,000 blacks, 63 for whites per 100,000, 66 for Latino, and 43 for Asians. These are all per 100,000 in the population. Now, when you look at that, you say, oh my goodness, that's a big gap between blacks and whites, and certainly an even bigger gap between blacks and Asians. So this is something that we would take a look at and say, well, this is fairly significant. What can we do to address this? Another area that the study looked at was infant mortality. So what are the rates in terms of infant mortality? For blacks, it's 9 infants die per 1,000 births. Latinos, 4. Whites, 3. Asians, 3. Again, the gap. Kind of a significant gap between blacks and other population. What about Suffolk County? They looked at figures from 2016 to 2018. Whites, 2.5. per 1,000, blacks 9.4. So that's quite a significant difference. Nassau County, whites 2.1, blacks 7.4. Again, a big difference, but certainly not as large as Suffolk County. There is a group called the Birth Justice Warriors. And you can see by their name what they are advocating for. In terms of this infant mortality situation, let's get some justice. Let's get some equity. There's this big gap, blacks and whites. What can we do to address it? This was a group that was co-founded by Maureen Hackett. Maureen is an associate professor of health professions at Hofstra University. And so this is a group that is an education group and also an advocacy group, and sometimes these would go hand in hand because you're doing all these efforts at education, this is the outcome. Well, how can we advocate for better health care, less infant mortality, less disparity? So you can see how the education piece and the advocacy group naturally go hand in hand. And this group works to reduce black infant and maternal mortality. So they've looked at these figures. They say this is a significant problem. What can we do to alleviate this problem? What can we do to help in this area? What are the leading causes? Premature birth, and this leads to low birth weight. So this would cause infant mortality. There's a certain stress that black women face, and they've studied the stress factors. Some of the stress factors would relate to unequal treatment. So women under stress who are pregnant, naturally this is going to be a factor in terms of infant mortality. Dr. Brian Harper, who is the Chief Medical Officer and the Vice President for Equity and Inclusion at the New York Institute of Technology in Old Westbury, and who was the former Suffolk County Health Commissioner, has also taken a look at this issue along with Maureen Hackett. And Brian says that what you have to work on is improving what's called the social determinants of health. New term for us, social determinants of health. What are these social determinants? Well, some of those determinants are, according to Brian, poverty, unemployment, residential segregation, environmental toxins, and institutional racism. So these factors can play into the health situation and can lead, obviously, to negative health outcomes. So what you want to do is, of course, study these and see how you can lessen the impact of these so that the health outcomes can improve. Also, very interestingly, the study has compared black and white people with identical incomes, identical educational levels. But the white person is more likely to get better health care and have better outcomes. So you look at it and say, well, why is that happening? They have the same income level. They have the same educational level. You would think, naturally, that they would have the same health outcomes. So again, these are things that you want to study, take a look at, and say, well, what can we do to improve this? What can we do to make our society more equitable, more just, better for all? It would lead to some conclusions about how we can obtain better outcomes. So in our next part, we will continue our discussion of these disparities and what we can do to create a more just, a more equitable healthcare system.